There are many medical and surgical uses for 3D models. Most commonly, surgical planning is done with 3D models. The maxillofacial region, other musculoskeletal applications. There are congenital heart patients, young children who have heart defects, and those defects are so complicated that the best way to actually understand what's wrong to plan how to fix it is actually to make a 3D model. So that's kind of one category of surgical planning. 3D printing is very important in patient care because many different plates and implantable devices are also done with 3D printing. And so someone has a catastrophic injury and they need a piece of bone or a piece of something that's made, that thing can be 3D printed in titanium and implanted in the patient. And finally, the most kind of futuristic and exciting part of new 3D printing is what we call bioprinting, which is actually making living tissue and 3D printing that living tissue, and so that it can then be part of the medical care. And that's really one of the major steps that's going to happen in the future of 3D printing to help patients.